Well, hello. My name is Jody Scholes, and I am your instructor for the MBLEx review course. Welcome. Today we are talking about anatomy of the lower body. We're going to be doing hips. We're not going to be doing posterior hips, but we're going to be doing hips. But we're going to be focusing mostly on the major muscle groups of the lower limbs. So that includes the hips, the legs, the ankles, and the feet. Yes, gonna cover them all. Right. Uh, and so I just want to say welcome and thank you for being here. This is a special time to come together because this is time that you have set aside to prepare for the MBLEx. And I'm just looking through my notes. So by coming together today, just by setting this time aside, and this is for you guys who are live, and actually if you're listening later, this special time that you have set aside sends a clear message to the universe. You are making this a priority. And when you make this a priority, the universe rearranges on your behalf to help. It's said that the universe conspires to help us when we make our goals clear. So, great work on that. And I want to mention also that there's no way this doesn't work out. I'm just saying. There's no way this can go sideways. Many of you have already taken the MBLEx once. Some of you have taken it 4, 5, 6 times. Today is different than every other day. There's no rinse and repeat here. This is your time to shine. This is the appointed time. I believe in divine order, that things happen for a reason, and they happen in the perfect timing. When you take on a goal like this, like passing a tough test, passing the MBLEx, you do so because there's something deep inside you that's motivating you. Look, if you weren't motivated, you would have given up on this a long time ago, right? If you didn't love this work, if you didn't feel that amazing connection with your clients, you wouldn't, this is hard, right? It's not easy to prepare for this. It's tough. It's tough on the brain as far as focusing for, 2 hours to take a test. It's tough on the ego because of course we're going to judge ourselves for how smart we are. These are all growing pains. And it's a-okay. It's a part of your journey. Breathe into that today. Breathe into wherever you're at right now. Just take a breath. And just know that this goal is way bigger than you. This isn't just about you coming up with something like, oh, I want to buy a new car. Great goal, but different. This is something that's coming from the inside out. And the desires of our heart is actually the will of the universe for us. You can say the will of God, the will of the universe, the will of spirit. We sometimes say, oh, am I on the right path? I don't know, You do know. You do know because it's the desires of your heart that have brought you here. And so, welcome. Welcome. Tune back in now and then when times get tough. When you've failed a practice exam, big deal, right? Big deal. if you fail a practice exam. It's part of the process. But if times get tough, come back to your breath. And also, dude, this is your destiny. I'm just saying, like, you don't choose massage. Massage chooses you. Yeah, yeah. And so, as a result, you are on the path of destiny. Bravo. Let's get to it, shall we? Let's do some learning. All right. Welcome back. Welcome back to your study sessions. This is Anatomy of the Lower Body, and I am your instructor, Jody Scholes. Today, we are going to be talking about the pelvis, the legs, the ankle, and the feet. Going to get nitty-gritty. Now, good news is you only have to remember the major muscles. We're going to be talking about the major muscles today. We're going to be talking about a few of the tinier muscles too. You do not have to memorize these. I'll remind you later on. You don't have to memorize them, but you do need to be familiar with the general location. And so today what we want to do is we want to identify all the different divisions of the lower limb, describe the bones of that region. Today's learning objective also is to describe the bones and bony landmarks of the major joints, and then understand the location and the names of those bony landmarks. The only reason we care about bony landmarks is because they're the attachment point for muscles. So, and they help us understand how that muscle moves. But let's get into it. Here we are. There's about 30 bones in the lower leg, on the lower limb. And these are the bones we want to be familiar with. This is our pelvis, or our hip bone, half of it. It leads out here to our femur. This is the anterior view of the femur. You're familiar with the knee. This little bone in the lower leg, we'll see another picture of it in a minute. That's the fibula, but let's focus here on the hip for a moment and the upper part of the lower leg, the upper part of the leg. Right here on each side is something called your greater trochanter. It's a bony landmark. It's on the femur. So this long part of the femur is called the shaft or the body of the bone. In here, and let's go move over to the other side, because if you'll notice, this is the posterior view. So again, we've got the femur, we've got that greater trochanter, but here you can see the lesser trochanter. If we were pointing it out from the anterior view, it would be inside here. So it's inside the leg. So we've got a greater and a lesser trochanter. All right. Moving down here, let's talk about some epicondyles. Epicondyles is a fancy way of saying bony landmark. And so lateral, easy peasy, right? Lateral epicondyle. Medial epicondyle. We know that lateral is on the outside, medial is on the inside. And here we see the patella. Going to see another picture of this in just a moment. But the patella, this is the bigger bone of the lower leg. And we'll see another picture of that in a minute, but it's the tibia. All right, just some familiarity with these epicondyles, trochanters, a tubercle. So a tubercle is also another name for a bony landmark. And you can see the adductor tubercle. Again, telling you that's where the adductors are going to attach. Let's move away from this. We're still here in the upper part. Excuse me. The upper part of the leg. It's a little bit bigger picture that you can see here. Here's our pelvis or our hip bone, the femur, the kneecap, that lateral, this is looking straight ahead, anterior view, lateral epicondyle, medial epicondyle. Good. While we're in the region, let's take a look at some muscles. So here you go. We've got psoas major and minor. They're normally not distinguished. We talk mostly about psoas major, okay? Minor exists, but we focus on the major muscles, right? Yeah. Now, let's extrapolate that to an important point. Let me just say, when we're talking about upper body and we're talking about the rotator cuffs, we've got 4 rotator cuffs, S-I-T-S. So those are major muscles. So that group is called a major muscle group, the rotators. So S-I-T-S. So that is S for supraspinatus, I for infraspinatus, T for teres minor. Even though it's a minor, it's still important. And then S for subscapularis. Supra, infra, teres minor, subscapularis. So even though in this case, I'm saying the major and the minor blend for psoas, the major and the minor don't blend with the rotator cuffs. It's teres minor. That's a rotator cuff. All right, back to our originally scheduled program in the lower body. Beautiful picture here of the iliacus. It is just on the inside. See how it's on that nice little inside curve? So the psoas major, psoas, and the iliacus work hand in hand. They're partners. And we get a nice little picture here of the brevis, adductor brevis, the adductor longus, and our gracilis. All of these are adductor muscles. These are some major muscles. That's why we're going over them. Nice thing about adductors, they almost all have the word adductor in them. Makes it a little easier, right? Yeah. All right, while we're here in the pelvis, a few more bony landmarks. This is the ASIS. So this little point right there, technically, is the point called the anterior superior iliac spine. So anterior, up, right? Anterior, front, anterior, superior and inferior are up and down, anterior and posterior, front and back. So anterior, superior, iliac spine. So the other word for this hip bone is the ilium, this part of the hip bone. All right. And here you see kind of a look through the pelvis. And we're seeing the sciatic notch and the piriformis muscle. But we'll see a posterior view of that, and that'll give you a better picture. But look here. Here's the tailbone, right? The coccyx. If you follow that up, the SI joint is the sacroiliac joint, sacrum and ilium. That SI joint is between the sacrum and the ilium, also called your SI joint. And sometimes this SI joint gets out of whack and can create sciatic notch pain. All right, we'll look more at that as when we look at pathologies. Another nice picture of the pelvis. We've got the iliums, got one on both sides. And you see how this nice sacrum comes down. And on each side, we've got a sacroiliac joint, or an SI joint. Sacrum, ilium. And a last look at the pelvis for a few more bony landmarks. Here is this hole is called the obturator foramen. So foramen is a hole. And the reason we care about that hole is because some muscles run through there and some nerves run through there. Nerves are usually yellow. Muscles are this kind of red or brown color. So here we see the pubic ramus. And we have the pubic synthesis. So when you synthesize something, if you play the synthesizer, you're actually blending, right? So the pubic synthesis is what joins the two pubic ramuses. Good. All right. Enough on the pelvis for now. Let's move down to the lower leg and let's identify some regions of the lower leg. So patella, that'll sound familiar. The patella is a region and it's also a sesamoid bone. It's a bone, the kneecap, right? We'll see more on that in a moment. Right below the kneecap is the tibial tuberosity. Bony landmark, another word for bony landmark. Tuberosity. It's where the patella tendon attaches, but look what it's a part of. It's part of the tibia, right? And you may say, oh my gosh, I have no idea where the tibia tuberosity is. Well, you know it's on the tibia. Yeah. So just again, getting the regions of the lower leg, becoming familiar with them. All right. So we've got, so this pes anserinus is actually another bony landmark. It's an attachment site, just on the medial aspect of the tibia here. Moving into another region that's more familiar, gastroc. The gastrocnemius is that nice big heart-shaped muscle on the calf, posterior. When you follow that tibia down, when you follow that gastroc down, you'll see what we call the Achilles tendon, but some books will call the calcaneal tendon. So that tendons attach muscles to bones. So in this case, we're seeing the gastroc and actually a little bit of the soleus. I mean, soleus isn't in here, but it's under that gastroc. And technically, the gastroc and the soleus turn into the Achilles tendon. So those two muscles, the gastroc and the soleus, turn into the Achilles tendon, are attached to the calcaneus. The calcaneus is the scientific name of the heel. So the heel tendon, the calcaneal tendon, or our Achilles heel, right? A nice test for the Achilles heel, the Achilles tendon, is just the pinch test. If we pinch it, is it tender? Nice to know. We'll work above and below it, but if it's tender, we probably want to stay away from it. All right, let's bounce back over to the front of the leg. You see the shadow of the tibia here. The tibia is the larger bone in the lower leg. And there's a nice big fat muscle on the side here, the tibialis anterior. We'll see more pictures of that momentarily. Let's slide down. And you can see that that tibia forms part of the ankle bone. It forms a malleolus, the medial malleolus. So your ankle bones are called the malleolus. And we have both a medial and a lateral. So the lateral malleolus and the medial malleolus. Good. And regions of the body, extensor digitorum longus, they extend the toes. Flexing the toes down when you scratch the bottom of your shoe. Flexing those toes, extending those toes. Yeah, good. All right, let's take a closer look at these bones, shall we? Here's the patella. This is the largest sesamoid bone in the body. We'll see sesamoid. Sesamoid bones are encased in a tendon. That's what makes them a sesamoid bone. They're actually encased in a tendon. All right. This is also called the kneecap. And look what we've got here. the tibiofemoral joint. The tibiofemoral. Tibia, femur. If you pulled those two words apart, tibia and femur, the tibiofemoral joint is your knee. And you'll see the femur articulates specifically with the talus, with the tibia. Good. So we're looking at, okay, now let's look at another word. Can you split this one apart? The tibiofibular joint. The tibiofibular joint, right? If you pull those two words apart, you get tibia and fibula. So it's where the tibia and the fibula touch. Great. The fibula is the little bone, the littler bone in the lower leg. So we've got both a proximal and a distal. We're dealing with a long bone. Even though it's the lower leg, it's still a long bone. And so we have a proximal tibiofibular joint, higher, proximal, and a distal tibiofibular joint. We want to talk just about one pathology of the knee for right now, and that's called patellofemoral syndrome. Can you split that word apart? Patellofemoral syndrome. Something to do with the patella and the femur. Yes, this is a degenerative disease or degenerative condition where the cartilage under the kneecap on that bottom underneath the patella starts to wear away. That's called patellofemoral syndrome. So even if you didn't know anything about it, never heard of it before, you could pull that word apart and you'd at least know the region of the body that you're in, the patella and the femur. And it's that degeneration, it's a degenerative condition, meaning that the cartilage is wearing away. Yeah, lovely. Quick look at the patella. This is the kneecap. As I mentioned, it's the largest sesamoid bone in the body. Sesamoid bones are simply bones embedded in a tendon. And most of them are found in your hands and feet, but this is the one we care about, the sesamoid bone. Now, some of you have watched the video on the varus and valgus stress tests. Oh boy, we're going there. Yup, varus and valgus stress tests. All right, shake it off a little because we've been looking at a lot of pictures. But this is a concept I really want you to wrap your brain around. Varus and valgus. The valgus test is related to testing the medial ligaments. And the varus stress test is about the lateral ligaments. So we're going to pause here for just a moment in the shoulder girdle. Best answer? Boom, the pelvis. Yes. Remember that obturator foramen is the hole. And why we care about that hole is because it's where some muscles and nerves go through. So the sit bones are at the bottom of that obturator foramen. The hole, the bone. Good work. All right. One more? One more. Let's do one more. Okay. Oh, here we go. This is a classic test of the medial collateral ligament. It is called the blank test. This is a classic test of the medial collateral ligament. What a great picture, huh? It's exactly what that guy was doing in the video. It's called the blank test. Is it called the various test? the ACL tear, the varus test, or the valgus test? You tell me. I will tell you that we can eliminate one wrong answer. It is not an ACL tear. ACL is the anterior cruciate ligament. It is in the knee. However, that is not what we are seeing here. Ooh, we're kind of split. Let's see. All right. Ooh. Me, yes, 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 yes. Muriel, yes. Tanya, yes, yes. Maya, yes. Kadeem, yes. Deja, yes. Deja. Nicole, uh-huh. Diane, nailed it. Ah, guys, got it. Yay! Best answer? The valgus test. Yes. So this is a classic test of the medial collateral ligament. It's called the valgus test because remember the walrus, right? Rus, varus, lateral. Walking sticks, walrus. Yes, good. You remembered. So the valgus test of the knee is used to evaluate the integrity of that medial collateral ligament. Good. If there's pain in this side, it's considered a positive valgus test or positive pain. Yay! That's it. We're good. So you got to the finish line. And what you'll know is that every finish line is also a starting line. So every finish line is also a starting line. But that is the end of our slides for today. And so congratulations on hanging in there and going through some pretty heavy stuff, right? Some pretty heavy stuff as far as our lower body anatomy. Look, you know where the glutes are. I hope you know where the piriformis is. We didn't cover those today. But what we did cover was some great anatomy and physiology of the lower body. So thanks for being with me. I'm going to stay on in the live class for a few more minutes to answer any specific questions. But as a reminder, my name is Jody Scholes. I'm your instructor for the MBLEx review class, and I'm really glad that you spent some time with us today. We'll see you again real soon, okay?